So great to be able to bring you to our listening audience here in Vermont. David Johnson is a national thought leader on healthcare. You're the author of not one, but two best-selling books. Tell me about the books first off.
Sure. I've got a bit of an unusual background. I was an English literature major in college and then a Peace Corps volunteer, and thought I wanted to go into either the Foreign Service or international development. Got a degree at the Harvard Kennedy School of Government out near neck of the woods, New England. And through a lot of twists and turns, ended up as a healthcare investment banker and did $30 billion of financing and M&A transactions, all the things you do for large health systems. And then 6 years ago, kind of went back to my roots a little bit and discovered that what I really wanted to do was write about how to fix a very broken healthcare system. And most people write about healthcare, write about what the government does, which is really important, sort of top down. But what always fascinated me, JD, was things like when Walmart said it wanted to be the largest primary care provider in the country.
Mm-hmm.
What did that mean?
Yeah.
Or when the Cleveland Clinic decided to go national with its cardiology program. So I say all of that as a prelude to my focus in both books is how to fix the American healthcare system bottom up through market-driven demand, as much or more so than top-down through regulatory improvement.
That is a tall order, my friend.
Yeah, well, I used to be 10 feet tall, and I carry the burden on me. But
wow.
I think when the dust settles, the healthcare in America will reform more through the bottom up efforts of these really innovative companies that are fundamentally reshaping supply demand dynamics, and less from sort of traditional players with acting from a government mandate, so to speak.
So the first book, Market versus Medicine, America's Epic Fight for Better Affordable Health Care. Yeah. And the second book, The Customer Revolution in Healthcare, Delivering Kinder, Smarter, Affordable Care for All.
Yes.
it basically, Jeff was telling me, Jeff Crilly, that you pretty much wake up every day and begin your day trying to do something, even one thing to help fix America's broken healthcare system. Again, I'm super tall order, buddy.
Well, I'm a big believer that we're not going to change the way we deliver healthcare until we change the way we pay for healthcare.
Right.
So a lot of the first book really focused initially on sort of the fragmented nature in which we pay for healthcare, and then how that in turn, distorts and fragments and provides perverse incentives for the way we provide care. So it all starts with Medicare. I'm sure your listeners are familiar with Medicare.
Oh, yeah.
And I don't know if you've ever seen how Medicare actually pays a hospital or a doctor for a procedure, but it's a very long formula. It takes into account 3 levels of acuity, wage rates, whether or not a hospital trains doctors, whether or not a hospital treats poor people, has all kinds of adjustments. There are, outlier payments and so on. Anyway, you get a formula like this long.
Mm-hmm.
And as a result, it's very easy to manipulate. So if you were to go to a typical hospital or doctor's office and really wanted to know what motivates the enterprise, they're spending all of their time trying to figure out how do they optimize revenue and ultimately profits by manipulating these payment codes, these payment formularies. And it starts with Medicare, but it also extends over into commercial insurance because they use many of the same procedures, diagnostic codes and so on, DRGs, resource codes and so on, that the government uses to pay for healthcare. So we end up with a system focused primarily on payment and not focused on outcomes and so on. So when I say we need to change the way we pay for care, what I'm talking about are things like full risk contracts. So, for example, if you needed your knee replaced, instead of going through this very complex formulary, there'd be a predetermined price, say $15,000, and that you'd have to provide a guarantee for that. So you as the provider already know what your revenue is going to be, not different from when you go to get your car fixed.
Sure.
And then you've got responsibility for doing the procedure and addressing any negative consequences of that. That's one kind. So that's for episodic transactions or episodic care. And then the other way is kind of what the fancy word is called capitated, but it's basically where a health system or a health company gets a per member per month payment, and for that payment, they're responsible for working with their members to cover all of their care costs. And that's beautiful because it incentivizes the health company and the patient to do things like early diagnosis and to promote wellness. It basically gets patients and providers on the same page. So instead of the circumstances where providers are trying to optimize the number of transactions they do and get paid as much as they can for them, the money's already taken care of. And it's just a function of, okay, how do we work together to drive the best health for myself if I'm a member, and then for all of our members if I'm a health company.
Now, you're in Chicago right now, am I right?
Yeah.
Here in Vermont, and I know this is the case everywhere. Hospitals are hurting, and they're especially hurting right now. They were hurting pre-COVID. We both know that, and now we've got essentially in many parts of the country understaffing. We have overtaxed employees that are overworked. They're burned out. The burnout rate in the medical field right now is massive because of COVID.
Right.
And even pre-COVID, so many hospitals, including several here in Vermont, have been really suffering financially, and several have closed across the country. You know that. You know, I was just in a discussion the other day with a good friend about, you go to that, complaining about, you go to the hospital, you get a Band-Aid, and that they charge you $10 for that Band-Aid. And his argument was, man, hospitals are hurting. I mean, basically in a nutshell.
Yeah. Well, you ready for a revolutionary idea?
Yes, I am. Very much.
Okay. We've got way too many hospitals in the country.
Wow.
So I'm not saying the way that we're paring them down is the most effective way, but let me tell you what I think. So I think of healthcare as an immature industry from an organization perspective, which is why we have too many hospitals, but very mature from a services perspective. So what do I mean by that? So 90+% of the times we need to go to see a doctor or need a hospital, we know what to do. I mean, they're fairly routine procedures. We can't always save people, but we know what to do. So when other industries mature like that, they tend to decentralize in order to get closer to customers, in order to lower their prices, in order to provide greater convenience for those who use their services. So as the product or service becomes more routine, more of a commodity, it decentralizes. Just think of almost any other business and that's true. It's why drugstores are all right around the corner from where we are. But in healthcare, because of the nature of the payment system, it's still got a very immature organizational structure. It's still overly dependent on high cost, centralized, think hospital delivery. And if COVID has taught us nothing else, it's how much of the healthcare we can get through virtual systems, in clinics, even in the home. I mean, one of the biggest businesses right now is hospital in the home, where they set up. So imagine if we actually built the system first to prevent illness and promote health. I mean, that's a whole other different conversation.
Whole different show.
But on the treatment side, if we just did it to how do we get the best outcome at the lowest cost with the greatest convenience for the customers? The only people that would be in hospitals are those that need really intensive around the clock care that you can't, for example, do at a hospital in the
Right.
home, or those with really rare conditions. And it's not
Or
that we don't need,
for some testing and analysis with with
yeah,
the computers and everything, the technology that they have there is not cheap at
right,
all.
right. So what's happened is these hospitals are burdened with these very high legacy costs, um, like you're talking about for the buildings, for the
Yeah.
facilities, And so if you go in to get a Band-Aid, instead of it costing 50 cents, it costs you, $50.
Right.
Or more to the point, an MRI, which is very common, um, in hospitals, the average cost is $2,500. And here in Chicago, anyway, we have a company called Smart Choice MRI, which is open nights and weekends, and you never pay more than $600 for an MRI, and you get a second read from the Cleveland Clinic.
Wow.
Why in the world isn't that good enough, right?
Yeah.
And so part of what we need to do is, for the things where we can put a market price on things, we need to level out the competitive playing field, let the market do what the market does, which is reward those who are the most efficient and best with customer service, and so on. But the kind of the challenge is, JD, is uh, we're just used to the way the system works right now. We it's almost a failure of imagination. We can't imagine not having a big hospital to run to in the event we need it. Although, for the most part, we don't need to go to hospitals for care. In fact, hospitals tend to be pretty dangerous places. You get infections spread there, and bad things can happen. Plus, the food is terrible. So, so my radical concept for you to think about is, imagine a world where we sort of had the right balance between the high cost centralized care and then the much less expensive but more effective kind of community-based networks of clinics and ambulatory centers, home-based care, electronic medical records for everybody. That's what we really ought to be thinking about. How do we build these really effective community health networks? And over time, how do we shift our emphasis away from treatment of disease to actually preventing the disease in the first place, or managing it much more effectively than we currently do? And why don't I stop there, because
Sure.
I can just keep going.
Of course. If
yeah.
you're just joining us, David Johnson is the CEO of ForesightHealth.com. David, big news unfolding this weekend. I'm sure it got it's got everybody's attention. The Food and Drug Administration gave Johnson & Johnson's COVID-19 vaccination the green light on Saturday for emergency use. Yeah, double thumbs up there. A much needed milestone to help get our country another step closer to returning to normalcy, and maybe some light at the end of the tunnel here. And lots of people saying this could be the break for herd immunity. What say you?
With herd immunity. It certainly helps with herd immunity. I think the general public doesn't appreciate how quickly the scientific community, the pharmacological community, has developed these vaccines. We've gone from, in under a year, from not having ever had a vaccine for any kind of coronavirus,
right,
to having now 3 in the United States approved and out in the marketplace.
And 15% of Americans already receiving at least one dose, and 2.4 million shots given in a single day in America. That's an all-time high, and that just happened the other day. That's huge.
Right, and it's going to go up. And I think this is an accomplishment of collective scientific effort on a par with going to the moon or the Manhattan Project.
Yeah.
using entirely new technologies. The Pfizer and Moderna vaccine uses messenger RNA, which is the body's software to create these or mimic the virus with the spike. It's the protein spike that triggers the immune system. So that's how Pfizer and Moderna work. The J&J and the AstraZeneca, which is also right around the corner, do something called viral vector, which is they take the spike piece of the coronavirus, neuter it, put it into a harmless virus, then put it into the bloodstream, and that then attacks cells. They look like the coronavirus, and the antibodies and the body's immune system attack it. So, JD, these are entirely new technologies that we're now using to attack disease, and they have enormous potential beyond just vaccines to treat things like cancer, where we're doing targeted therapies and so on. So one, I just wanted to get that out there, is that we seem to be on the precipice of a dramatic leap in our ability to quickly respond not only to infectious disease, but any type of organism that's attacking the body. Now, we have Pfizer, we have Moderna. J&J comes on. It's a different technology, and what's great about J&J is it only requires one shot.
Right.
It only needs to be refrigerated.
Sure.
Doesn't need the super cold temperatures. Therefore, as we're trying to think about how do we vaccinate as much of the population as possible, imagine these hard to reach groups,
Sure,
like homeless people.
Sure. Disabled, elderly, hard to reach places, rural America. Oh,
Right.
The list goes on.
So one shot and you're done.
Yeah.
So to me, it gives great flexibility to the arsenal. And
I read a little bit. I read a little bit over the weekend that there's some studies saying that the Johnson & Johnson vaccine may be a little bit less effective as the other two, and that it really targets the more severe complications of COVID. Any truth to that?
Well, first off, it's Pfizer and Moderna it's almost unbelievable, right? They're 95% effective.
Yeah, right.
We would have been happy at 50%.
Sure.
So
of course.
that's the way infectious disease typically works. The J&J is coming in on overall effectiveness around 70%, which is still very, very good.
Yeah.
But importantly, we don't want anybody to get sick. But if they happen to get sick, we really don't want them to get really sick or die.
Right.
And there've been no deaths. Repeat that: 0 deaths from anybody who's taken the J&J vaccine. So
important to note.
Yeah, preventing death is a good thing, right? So so I right now I think we're in a period of scarcity, and people should just get whatever vaccines available to them. Shouldn't be trying to optimize. I want Pfizer or Moderna or J&J or AstraZeneca when it comes out.
Yeah.
So not play that game. So it's a really great addition. Maybe not quite as overall effective as Moderna and Pfizer, but has some capabilities that they don't.
Sure.
So overall, just a great addition to the infectious disease arsenal.
Outstanding safety profile, performs well. I mean, these are all great points. The FDA is obviously watching things very, very quickly. We're going to wrap things up here in just a little bit, but before we head out, Dr. Anthony Fauci was just on NBC's Meet the Press saying children could start getting COVID-19 shots before the end of the year, and that some companies have already started studies on how to make vaccines that are safe for kids under the age of 12.
Yeah.
Do you have any insight on this?
Well, right now, Moderna is good for ages 16 and up. Pfizer and J&J are 18 and up. All three companies are starting trials on kids, all the way down to neonatals.
Wow.
So I'm not going to counteract Dr. Fauci. He's on top of it. But the good news is we're starting to get into the trial phase for children as well as adults. And, to get to that 75% number, we need to keep the kids from getting COVID as well, particularly since they tend to be super spreaders.
Yeah.
They aren't as likely to catch the disease, but they are much more likely to spread it.
So possibly by the fall, high schoolers could start receiving vaccinations.
Yeah.
Incredible.
Well, and those in high school above 16 right now can get the Moderna vaccine.
Are you feeling pretty positive? Do you see a little bit of light at the end of the tunnel?
Yeah, a little bit. It's, I got asked last week to predict the when we're going to hit herd immunity. I had a boss once, JD, who said, it's complicated, Dave. Don't screw it up.
Yeah, right, right.
And this is real. This is really complicated.
Sure
it's
it
not
is.
any one factor. We the Western approach to science is somewhat reductionist. It's focus on one variable, isolate it, and then solve that particular issue or problem. But here you've got multiple factors that interact with one another that are going to determine how well we or when we achieve herd immunity.
Yeah.
First is, just the availability, distribution, and so on of the vaccine. We aren't completely sure what the transmission rates are, although the early information is pretty good, but we don't know for sure that once people are vaccinated, whether or not they're going to transmit. We have these new strains of the virus that are out there, some of which are very dangerous.
Sure.
We also have a fairly significant segment of the population that's reluctant to take vaccines. So it's not any one thing, it's all of those things interacting together that are going to be determinative. But having said that, I've seen estimates of people. Oh, and then the other thing is the degree of antibody protection that we get from having had the disease. And we don't really know how many people have had the disease.
Yeah.
And if you have a weak disease, how much it protects you. So I've seen predictions as early as April that we'll achieve herd immunity from credible sources. They tend to put enormous weight on the degree of antibody protection already out there in the population. And we'll use that to explain why we're seeing the decreases we are. Others that are more worried about transmission, these new viral or virus strains that are coming out that people won't get vaccinated are much more cautious. And overall, then the other thing is, do we continue to maintain the public health behaviors, which we've gotten better at as a country, to keep that in check? So anyway, I kind of think we're looking at late summer, early fall as sort of the earliest that we could achieve the herd immunity, but I don't think I think it'll happen before the end of the year.
That's what I was going to ask you next. Yeah. I mean, I'm hearing, what I've read is May, but what would what's the worst case? What's the worst case scenario? So maybe fall.
Absent another breakout, and we're down under 50,000 cases a day, but it wasn't that long ago we thought 50,000 cases was a lot.
It was a lot, yeah.
If we're to get another spike off, even at 50,000, we could be, back to the point where hospitals are filling up and the disease is spreading and so on. So so absent that, if we're able to kind of maintain kind of current levels, but people are reluctant to get the vaccines or transmits a little bit, then I think you're looking, really toward the end of the year, hopefully not into next year. But no guarantees.
Wow.
What I can tell you is, imagine we were where we are today without the vaccines.
Right.
I think we'd be looking at a much, much darker future.
Sure. Before we head out, tell us a little bit about foresightshealth.com, and that's that begins with the number 4.
A
little bit
my
about
nephew says foresight.
Yes. Tell us a little bit about that. We want to know if you're working on a third book here.
Well, as I told you, I'm a repurposing investment banker. So you don't meet many investment bankers that turn into writers. So
that's right.
I'm unusual in that regard. But I figured out a while ago, and you're an example of this, that digital changes everything. So we have gone from a kind of a world where we didn't have enough information to one where we're overwhelmed. And most companies historically created knowledge, protected it, and then rented it out. So if you think of law firms or accounting firms or so on, and that just doesn't work today for two reasons in the digital world. It's one, knowledge is exploding at an accelerating rate. I mean, used to be medical knowledge doubled every 50 years. Now it's doubling every 6 months. So there's just no way for any one person to have and sort of protect all that knowledge. And then secondly, it's getting much easier to hire expertise.
Yeah.
So game today is really knowledge exchange, and you have to give as well as take. So we've built Foresight Health to be a company in healthcare that practices or plays in this knowledge exchange world that we're in. So we're a content creation and a media company. And so we help our clients develop thought leadership that people are actually going to read and listen to. And we try to connect with them, with the audience in the ways they want to connect. Because the trick in today's world, and you know this just because you do what you do, is to be networked enough so when the right idea and the right need comes, the network finds you. And it's a little more complicated than the old days where you'd go to law school, put up a shingle, and the world would come to you. So
yeah.
So that's we're kind of a 21st century company trying to help our clients and ourselves sort of participate in this knowledge exchange and be in the right place at the right time to offer the right advice. And honestly, back to the original point, we spend almost 20% of our healthcare or of our economy on healthcare, and yet we've got declining life expectancy, and 90% of our expenditures go to fund chronic disease. If we can somehow turn that around and get the same or better healthcare for less money, imagine the resources that we could free up to pay people more, to invest in more innovative industries, to lead happier, more productive, healthier, longer lives. And so there are a lot of priorities out in the world right now, but I think getting our health system turned around and doing what it should be doing, instead of acting as a tax on the American people, actually providing energy and ways to really lead these longer, healthier, happier lives. So
what a concept! What a concept!
Yeah.
Boy, I'll tell you, if you're ever going to be doing any speaking or consulting or advising anywhere out here in New England, I'd love to know about it. I'd love to be there.
Okay, we'll do that. Well, let's stay in touch. I'll tell you one last thing that's because I do this thing called Dispatch every Tuesday and Thursday. I write up on what's ever on my mind. So tomorrow I'm going to write about how I finally managed to get a vaccine appointment, which is a pretty entertaining story. But on Thursday, I just read this piece out of Stanford Business School, and we know how horrible administrative costs are, highest in the world by factor 4 or 5. But I had never seen a study that looked at the overall effect on the economy of our administrative costs. So if you think at the individual level, how much time we spend on the phone with insurance companies or filling out forms or so on. Well, it turns out that you aggregate that cost of all the lost time and energy devoted to just addressing healthcare administration. So as bad as it is on an absolute basis, its cumulative impact is even worse, far worse, orders of magnitude worse. So imagine again, what an opportunity for companies to come in and make all that easy.
Yeah.
Imagine, hard to believe, but imagine that.
There'd be a lot of and there'd be a lot of funds being just redistributed in other ways.
Right. So that I'm going to write about that on Thursday.
Interesting.
But would love to let you know what's going on when we get out to New England. I haven't traveled in a year. American Airlines is very worried. They called me up a couple of times to see how I'm doing, but because it's been almost a year, probably a year next week that I haven't traveled, and I used to be executive platinum. So,
hey, do you have time for one last question? We just got
sure.
a listener that we just had a listener that wrote in. Will COVID be like rabies? Once we inoculated everything within 4 feet, the disease virtually died out with the lack of a host.
No, unfortunately, it's going to be more like influenza, bird flu. It's going to be with us. Coronavirus is going to be with us. I believe it'll actually get baked into the annual flu shot, and we'll contain it. And we will hope that we won't have more of these periodic outbreaks. We've been able to contain them for the most part. When you think of Ebola and some of the bird flus and so on.
Yeah.
Swine flu.
Swine flu.
But no, unfortunately, it's going to be with us for a while. And the good news is that the tools we have to combat viruses are obviously better than they've ever been before. The bad news is our world is so much more interconnected.
Sure.
The ability for viruses to spread and wreak their havoc is greater than it's ever been as well.
Absolute pleasure having you on. Aired out this afternoon. Thank you so much, David Johnson, live in Chicago this afternoon.
Yeah, where the snow is melting.
It is here. It is here in Vermont as well. It's we've got a lot of rain going on right now and some mild temperatures this week. But listen, be well, take good care, and I would love to have you back on the show sometime. We will stay in touch, and
perfect.
Good luck with your books, and we're going to of course you can get them anywhere, Amazon or otherwise. But we're going to post. We'll post
or at our website. In fact, again, that website, foresightshealth.com, Foresight Health. We've got a ton of content on there. So if any of this stimulated interest in your audience, check us out.
That's the place to go to. Yeah, we'll link it up again on the page here. And thank you again so much, David.
Okay.
Absolute pleasure. Wow, love conversations like that one right there. Amazing.